Thank you, Madam Chair, and appreciate the opportunity to submit testimony on Senate Bill 84, an act concerning the revenue items to implement the governor's budget. I am Dr. Rob Roose. I'm the president of our community hospitals for Trinity Health of New England, which includes St. Mary's Hospital in Waterbury, Connecticut, and Johnson Memorial Hospital in Stafford Springs, Connecticut, as well as our mobile health care organization and emergency medical services. I'm joined here by with Dan Keenan, our Senior Vice President for Government Relations and Advocacy as well. I did want to state that Trinity Health of New England is eager to continue working with members of this committee, the governor's administration, legislative leaders, and members of our General Assembly to adopt an approach to the hospital tax program that would indeed maximize the federal resources to support patient care across Connecticut. That's important. We do oppose, however, provisions of the proposed budget related to the hospital tax as it is drafted. Trinity Health of New England is a significant provider of healthcare services in Connecticut, including St. Francis Hospital and Medical Center and Mount Sinai Rehabilitation Hospital in Hartford, St. Mary's Hospital in Waterbury, Johnson Memorial Hospital in Stafford, and we also have a clinically integrated network, physician practices, home health, and post-acute services. We are comprised of nearly 9,000 healthcare providers committed to the communities that we serve. Trinity Health of New England is unique in that St. Mary's Hospital and St. Francis Hospital have among the most challenging payer mix in the state and are two of only 4 hospitals with more than 30% of the patients that are served covered by Medicaid or without any coverage. We are truly a safety net for the communities we serve, and we bear a disproportionate share of the financial challenges of the inadequate reimbursement from Medicaid and Medicare that was discussed earlier. The financial performance that results from having a disproportionate burden of Medicaid patients and also inadequate commercial rate reimbursements has left Trinity Health of New England with significant operating losses, and it puts an enormous strain on our ability to ensure access to care. These challenges are compounded by a hospital tax system that has not strengthened but rather significantly weakened safety net providers like St. Mary's Hospital and St. Francis. To that point, in the state's fiscal year 24, Trinity Health of New England hospitals paid in approximately $86 million in hospital taxes and received approximately $48 million back in supplemental payments, a deficit of more than $38 million. These supplemental payments returned only 56% of the taxes paid to our hospitals.
You've reached 3 minutes. Please summarize.
Compared to the average hospital receiving approximately 67%. And so this creates a unique and unexplainable structure for a hospital system like St. Mary's and St. Francis that are serving the most vulnerable. So we believe a new perspective is needed, one that views the tax certainly as a mechanism to maximize federal dollars, but also one that can preserve and support safety net hospitals like St. Mary's and St. Francis. We appreciate the interest and the support of our policymakers in helping us create a stronger healthcare system.
Thank you.